The purpose of this video is to discuss and demonstrate some issues that occur during sow farrowing and how to properly assist sows when needed. We will discuss different piglet orientations in relation to the pelvis of the sow and the best techniques for removing stuck piglets. Safely removing stuck piglets in a timely manner can reduce stillborn piglets while minimizing injury to the sows in the process. Before we discuss piglet orientation, let's go through the birth canal of the sow and its orientation in the body. The sow's reproductive tract sits just below the rectum and partially rests on the pelvis of the sows. The cervix of the sow rests just cranial to the pelvic bone. Upon time of parturition, the reproductive tract hangs down toward the underline of the sow just cranial to the pelvis. This orientation of the reproductive tract is an important key to understanding some problems with parturition and how piglet orientation can affect it. Piglets are born from the reproductive tract about 50% of the time head first and 50% of the time hind legs first. Problems can arise when piglets are born in either orientation. Typically, piglets born head first should come out with their front legs bent back toward their midline, pointing to their back legs. When pigs are born hind legs first, their front legs will straddle their head. When piglets are born head first, the most common problem is the size of the piglet. Large piglets often get stuck right at the pelvis of the sow due to their large shoulders and head. At times, a front leg may also get stuck in the way, crowding the narrow pelvis more. Another issue is that piglets should be born with their ventral side facing the ventral side of the sow, as opposed to the dorsal side of the sow. And some will be born upside down. Due to the angle of the reproductive tract and how the tract is oriented in relation to the pelvis, piglets often get stuck when upside down. When piglets are born hind legs first, the most common problem is when their back legs are facing cranially. That is, all four legs are pointing toward the piglet's head. This is troublesome because the rear end of the piglets often cannot fit through the pelvis of the sows. As with head first births, in the hind leg first orientation, piglets can also be oriented upside down, creating problems. When attempting to assist sows during farrowing, these orientations of piglets are the most common problems seen. Before we discuss these particular orientations, let's go through the process of farrowing assistance. Be sure that the sow is in fact in need of assistance prior to entering the vagina of the sow. If assistance is required, you will need an obstetric glove and some lubrication. You will want to use a new clean glove for each sow. With a clean obstetric glove, spread the lubricant on and within the vulva. If the sow is lying on her left side, it is easiest to use your left arm to assist the sow, and right arm if she's on her right side. As you work your hand into the vulva of the sow, put all fingertips together, making a cone shape with your hand, and arc your arm as shown here. Slowly ease your arm into the vagina of the sow until you reach the pelvis. You will feel a narrowing of the tract surrounded by the pelvic bones. At this point, you will want to move particularly slowly as you can damage and tear the reproductive tract. Once past the pelvis, you'll be able to determine the cause of the dystocia. Now that we have a better understanding of how to initiate farrowing assistance, let's go through some of the piglet orientations that cause issue. In the head first orientation, the major cause of farrowing trouble is the size of the piglet. First, check to see if the piglet is in the correct orientation, which is with the ventral part of the piglet's body pointed down towards the belly of the sow. In the event that the piglet is upside down, you will have to attempt to push the piglet back and reorient the piglet in the proper position. Assure that the front legs of the piglet are pointed towards the hind end of the piglet's body. Once in the proper orientation, place your index and middle fingers behind the ears of the piglet and gently pull the piglet's skull. Ease the piglet into the pelvis area of the sow. Gently pull the piglet through the pelvis of the sow until completely removed from the birth canal. If you cannot remove the piglet with its front feet pointing towards its hind end, another option to try is to pull the front feet up towards the piglet's head to remove the piglet. This can be challenging to hold the head and the feet together. If the piglet is oriented hind legs first, you will most likely find that the piglet's hind legs are pointed towards the head of the piglet. Push the piglet back and attempt to pull the hind legs of the piglet into the proper orientation. Do so by grabbing the hind legs just above the hocks of the piglet. Place your index finger around the outside of the hock, middle finger between the hind legs, and ring finger around the outside of the other hock. Gently pull the piglet through the pelvis, keeping in mind that the chest and head are the widest parts of the piglet, so be sure to pull slowly. Continue pulling until the piglet is out of the sow. Once the piglet has been removed from the sow, be sure that the piglet is breathing and clear any mucus from the mouth and nose. If the sow had not had a piglet in over an hour, oftentimes there will be more piglets behind the one that was stuck. Because you've already entered the sow for assistance, re-enter the sow and make sure there are no other piglets in the tract. Oftentimes, piglets back up in the tract after one has been stuck, and it's best to pull those out to make sure they don't suffer from oxygen deficiency. In summary, make sure that the sow is in need of assistance. Use an OB glove and plenty of lubricant. Make your fingers in the shape of a cone and move slowly. Determine the cause of the issue and reorient the piglet into the appropriate position. Grab either the hocks of the hind legs or the head behind the ears of the pig and gently pull the pigs from the sow. Be sure that the piglet can breathe and then check for more piglets.